Hello, students, and welcome to our final week of our course. I hope things have gone well for you and you're wrapping up your final assignments. Thought I'd take a few minutes to just talk with you about where we've been and where we're going in terms of this course. We looked at this class as an introduction to marriage and family therapy. I hope by now your skills are enhanced in terms of how you approach a couple or a family from a family systems approach, right? Rather than isolating just the husband or the wife or the child and taking a silo effect. We now look at the family or the couple as almost an emotional unit and treat them, including all the various variables and tentacles that are a part of this family unit that we're treating. We went through these 7 outcomes, and just in terms of a quick survey again, the first one was the history of marriage and family. Various theories, various researchers. We looked at all kinds of approaches from the psychodynamic all the way to narrative marriage and family therapy. So I hope you've had this exposure and you can look over these things and you can consider them from the standpoint of which ones you may prefer over others, perhaps. The second outcome was to practice assessments, putting together a case, some of the techniques like in the mock sessions when we actually practice these things. And the assessments, I hope you see, are very, very important because they give us a measurement, often both a qualitative and a quantitative measurement at baseline from which we can measure the progress of the couple or family through the course of therapy. The third outcome and fourth, discover ethically and culturally relevant strategies in marriage and family. The ethical side there is important because ethical matters are a little bit different, right, in marriage and family than they would be in individual therapy or, let's say, in a group setting. Confidentiality, for example, if we were to see the couple individually or the couple individually from the family or the child individually from the family, how would informed consent work there? And then this other outcome I have here, this fourth one, evaluate the impact of heritage, attitudes, beliefs, and understandings and issues of culture, something that I'm sure you're aware of. Viewing the sessions, the case conceptualization, all of these things, even the techniques, from the standpoint of the lens of the counselees, their race, nationality, ethnicity, spiritual or religious background, attitudes, understandings. What are all of these things this person or these people bring that I need to be aware of as a clinician, because it's going to impact what kind of technique I utilize, what kind of strategies, what kind of homework, because, of course, everyone is different. The next course outcome is to integrate other contextual dimensions. I say other because we've already looked at some contextual issues, but this broadens it in this 5th course outcome. Look at some of these things that I have listed: single parents, blended families, various views of human sexuality, aging, intergenerational influences, and the list goes on. All of these things very important. Employment, socioeconomic status, physical health, and other matters of, let's say, psychotropic medications. We bring all these in together, hopefully in the intake documents and intake assessments. And by the time we get into the therapy and we choose our techniques and our strategies, we brought all these things into mind. And then the sixth outcome, recognize the importance of marriage and family certification, licensure, etc. These are matters having to do with our profession. Marriage and family therapists, per se, would be licensed, but many of us are not going to be licensed marriage and family therapists. We're going to be LPCs, or we're going to be licensed in psychology or something like this. So we want to be aware of where we are in our profession, whether it's psychology, whether it is counseling, whether we become a licensed marriage and family therapist, and then to also consider certifications beyond licensure. Perhaps when we're finished with our degree, when we're done with our licensure, down the road, we say, I want to go back and I want to be certified in one of these areas of therapy, so that I become an even better acquainted and an expert in this area. So consider that as well as you think through what we've gone through and studied in this course. The seventh outcome that we established was to summarize biblical and theological philosophical assumptions of contemporary views of marriage and family therapy from a Christian worldview, and to seek to demonstrate it. So our reading, some of the videos, certainly the quizzes and other assessments and things we've engaged in, they've exposed us to the Christian worldview, and hopefully we have an understanding of that so we can utilize it in our treatments. Those are the 7 course outcomes. But going forward, let's switch a little bit here and ask ourselves, what can we do as the course ends and as we look forward when we think of marriage and family therapy and utilizing these things that we've learned? I would say first to be aware of your personal history and life when it comes to marriage and family therapy. Maybe there's things about your background, your life, that are still active and perhaps unfinished business in your life. When you come and sit in a session, it could be that the couple sitting before you or the family that's there could be a moment in which you're tempted to be negatively affected, or there could be countertransference because you're remembering back to some unfinished business in your life. Think about continuing to work through those things. Be aware that you should be taking steps not to be impaired when it comes to this very important and vital area, like when we're dealing with children, when we're dealing with susceptible couples and in difficult situations, that we need to be very much the professional and able to deliver competent treatment. I would also say to continue to reflect on your skills. I mentioned earlier about certification in one area. You won't become an expert in all of them, nor will I, but maybe you're drawn to a certain population, single moms, adolescents, the elderly. Maybe you're drawn to certain type of marital difficulties or family difficulties like conflict resolution or blended families and working out the issues there. I encourage you to pursue those areas, and you may, in fact, be known in your practice as the person who is especially good in those areas. Bring your learning also to other courses. Don't look at your courses as standalones, but rather link them together. It could be that marriage and family, this course will be the only one in which you really drill down into marriage and family. So you've studied it directly. The other courses will not, you will not study marriage and family directly per se. There may be some exceptions if you take some other courses, some electives and things like that. But my point is that you will find in these other courses areas of overlap, like human development, assessment and testing, vocation and career, psychopathology. And you could be thinking through, okay, yeah, I see this in marriage and family therapy, like human development and where children are on the human development spectrum. Vocation, maybe a couple is having difficulties because the husband or the wife, they've lost their job and that has sent them into a crisis, and now they come for marriage therapy. Think about, as you go forward, how all of these overlap, how they in large part integrate. And as you do, and you keep looking at the big picture, you'll become more refined as a professional. And on a personal note, be patient with yourself. Making progress is the important thing. Be careful about too much self-criticism. We want to critique ourselves. We want to become better, but we don't want to shame ourselves unnecessarily. As I mentioned, marriage and family is immense. It's impossible to be an expert in everything. So try to master the essentials and branch out from there. Keep learning, even after you've graduated. There's plenty of outside sources to draw from, as I mentioned. Certification, there are seminars, endless books, and as we all know, manuals, podcasts, and websites. Remember, no one is perfect. Do not expect to be perfect. And even the most experienced counselors make mistakes. They learn from them and move on. In my personal counseling practice, I try to reflect after each session when I'm doing my counseling notes, my process notes, my personal notes, or my clinical notes. What maybe did not go so well? Or what can I learn from this? All of us are in process. Don't underestimate, I would add, don't underestimate the way that God can use your marriage and family counseling in his kingdom work. By addressing these particular difficulties, you become a positive force for the church and for society. Those who are watching this video, for example, might be hundreds, if not thousands of people who represent clients in the hundreds, if not thousands. And think of all the couples that we can help, perhaps to bring from unhappiness and depression to harmony. Think of all the children in families that are perhaps in conflict or who have a great degree of fear about their family life, perhaps like a blended family. And think of how we can alleviate the suffering of children, alleviate the suffering of a married couple, how we can help them and assist them in ways that really will provide a catalyst for a vastly improved life for many years, if not for the rest of their lives. So this is a very important thing that we do here, and see yourself as a tool in the hand of God that can be used to help suffering people, and not just in their suffering, but to also guide them to prevent future difficulties. So in summary, we've looked in this video to the contents of this course. We've gone over these course outcomes that I hope we have fulfilled to a reasonable degree. We're looking to link the content of the class with future courses to drill down and become an expert in an approach or two. And we've seen that we want to be patient and accepting of ourselves, realizing that we're making progress as a counseling professional. And above all, I would say we are to be utilized by God in this profession in which we find ourselves. And I want to add as well, I don't believe there's a conflict of interest when we seek to serve the Lord and use evidence-based treatments as a professional. Even the latest versions of the ethics codes, whether they're Christian or secular, promote the importance of spirituality in therapy and how spirituality can be a part of evidence-based treatments that bring the best outcomes. I believe it can be a seamless enterprise between our Christian faith and living out and exercising our licensure as professionals, as marriage and family counselors and therapists. The key idea that I brought out before is autonomy. In our ethics codes and in the Bible, being able to allow the client to make their own decisions. And as we're given permission, as we're given freedom to introduce the truths that best fit that client, whether they be wisdom from the secular sources or those that are directly from God's word. I hope the best for you as you finish up this week. And I look forward to seeing you again, perhaps in a future course.